Good morning, Dr. Rosenberg. It's a great pleasure to be once again with you. It's a pleasure to participate in this great event that has been organized by FIU. I also want to express my gratitude to Maria Paula Correa, my Chief of Staff, who's joining us today. I want to express my gratitude to Minister Fernando Ruiz, to Carlos Espinal, to Tomás Guiliarte, and I am very honored to participate in an event where we're going to talk about international health. And obviously, this is a pretty uncommon year, especially because we're all struggling with a pandemic that was not on any governmental radar. But I should say, Professor Rosenberg, that these are times for the world to learn, to adapt, and to accelerate history. And I want to begin my remarks saying that what we're suffering today, it's something that was in the head of many experts, but we never in the multilateral environment thought this was going to happen that fast, and it was not, and we never thought it was going to be so harmful. So let me begin by saying that last year, the World Health Organization had an expert panel that was led by Gro Harlem Brundtland, the former Prime Minister of Norway. And in that report that was called A World in Crisis, in the third chapter, there was a very specific reference that the world could suffer from a respiratory virus that can turn into a pandemic. They were apt to conform a group of experts, and they also made a big call so that heads of state could participate in preparedness and analysis of what could we all do if we were going to suffer a circumstance like that. The panel was supposed to start in September 2020, but it was very unfortunate that we were all surprised by the evolution of COVID-19 at the end of 2019 and at the beginning of 2020. COVID-19 represents the major world threat we have all seen maybe since the Second World War. And we know that it's a lethal virus that can affect tremendously people that have pre-existing conditions, comorbidities. And we also know that to contain the virus, many restrictions have to be adopted. And when the year began, and we saw what was happening in China, and then we saw the effects in Europe, we understood that the virus could spread so fast that it could put in jeopardy the capacity of the health systems to respond in a rapid way. We even saw healthcare systems in the world that we have all praised as one of the strongest struggling because they were running out of ICUs. All this was happening, and when we make the reflections in Latin America on how should we all react, we said that we have to act fast, gradual, and we have to take draconian measures. In the specific case of Colombia, we decided to organize a response based on three pillars: preparation, and we also had the concept of prevention. The second was the concept of containing the virus. And the third element was mitigating the virus. So when we first started to monitor the situation, we became the first country in Latin America that could undertake PCR tests to identify COVID-19. But we had at that moment only one lab in the country that could process more than 1,000 tests per day. We also realized that we had to have an epidemiological monitoring system, which we also introduced at the very early month of February. And since then, we were also preparing the system in the case we had the first positive patient in Colombia. We had that first patient in March, and we decided that we had to make an expansion not only on the response system, but we also decided to gradually and rapidly undertake measures such as closing borders, restricting airlines coming to Colombia. We also kept students out of school and out of universities and preschools. And we also declared an isolation of people above 70. And last but not least, we decided to have a national prevention isolation. With that, we also recognize that there were a lot of debates taking place in the world where populism and demagoguery were trying to generate a false dilemma between protecting the health system and protecting social and economic development. So that's why, in all the measures that we undertook, we were very clear that we had to keep a very important level of the economy running. So even when we declared the national preventive isolation, we understood that 40% of the economy had to be running. And since then, we were doing every 14 days a gradual recovery of economic activities. So we were able to keep on pushing responsibly for that process to happen. And when we reached the 1st of September, that was the moment where we changed the concept of the national prevention isolation into the concept of individual isolation and individual social distancing. We had more than 90% of the economy running. But then the question is, how did Colombia perform? How has Colombia performed in the midst of COVID-19? The first thing that I should say is that we, in the last 6 months, passed from one lab with the capacity of undertaking 1,000 PCR tests per day to more than 100 labs, either public or private, that can process more than 37,000 PCR or viral tests per day. And that represents a major jump. That represents the strengthening of our capacity to have epidemiological control and the capacity to process information in real time in order to address the need to identify the cases and make isolation of the people that could potentially be infected. The second thing we did is that we decided to expand the ICU capacity in Colombia. At the moment where the pandemic began, we had around 5,300 ICUs. And we were one of the countries in Latin America with the highest density of ICUs per 100,000 inhabitants. Today, we have been able to double that number. And we're getting close to 11,000 ICUs. That is the more rapid expansion of ICU capacity we have seen in recent history in Latin America. And with that, nobody has been left behind. And we have been able to create ICU capacities in municipalities that never, ever had that capacity. So that's a very important objective that we have reached. We also decided to create the national stockpile so that we could have PPE to attend the needs of the people in the healthcare system. And that's why today we have a national stockpile with more than 40 million pieces of individual protection for the people that are in the first line of response. We have also been working closely on having bioprotocols on different sectors. So as we were evolving into having a reactivation of workers, we also had more than 35 protocols for different sectors that have to be fulfilled day by day so that we can have a secure reactivation of the economy. But that's not just all we have done. We have empowered telemedicine, and we passed from having something close to 400,000 people that were attended by virtual medicine now to have millions of Colombians that could use that service. We have also enhanced the possibility of have online medical records. And we have also created a mechanism so that we have an additional payment for those people in the first line of response in COVID-19. We have also made something very important. We have strengthened the capacity of the hospital system throughout Colombia, and we created an app that is called Core Colombia, where more than 12 million people receive on a permanent basis, day by day information, real time, about the behavior of the pandemic in our country. Those things have been very important objectives that we have reached. And when we evaluate on the results, we must say that we have been working closely with the World Health Organization and the Pan American Health Organization so that the indicators on how we evaluate the behavior of the pandemic in Colombia are connected with the individual and at the same time independent analysis from experts. As of today, Colombia has a pretty low lethality rate. Our lethality rate is around 3.1%, which is below Germany, below the UK, below France, below Italy, below Belgium, below Sweden, and below many countries in Latin America. When we evaluate how has Colombia behaved in terms of deaths per million inhabitants, our numbers show that we have a performance where we seem to be below very much developed countries of the OECD and other countries in Latin America. When we have also analyzed the expansion of our ICU capacity, we passed from having 11 ICUs per 100,000 inhabitants to have more than 21. And today, we can also say that we're getting close to 90% recovery rate. And we have seen the cases on a daily basis and the deaths on a daily basis been dropping down. Can we feel triumphant? The response is no, we can't. But we are very much aware that if we keep on having a secure reactivation of the economy, we will be able to do much better. But it's also interesting that the response we have had has not only been connected to the way we behave on the healthcare system, but also on how we respond to the poorest of the poor and how do we protect employment. Because, as I said, there's no dilemma. Without a good healthcare system, you won't perform better in terms of social and economic development. But since we have also made a clear analysis, without good social and economic development, we won't improve continually our healthcare system. So there's no dilemma. And we understood that the measures we made had to be supported with social and economic measures. So that's why we expanded the conditional cash transfer mechanisms to attend more than 3.7 million families. They are families in action, youth in action, and the protection of the elderly. We decided to have extra payments to those in need in those segments. And we also created a non-conditional transfer of resources to families that could be potentially affected and that had never in the past received a single transfer for the government. And we're talking about 3 million families. We also decided to create a mechanism to give back the payment on the VAT tax for the poorest of the poor. And we created that measure for 1 million families, and we will have 2 million families in 2021. We also decided to protect the employees that could potentially lose their job. And that's why we created a program so that we could subsidize 40% of the payroll of those workers that work for companies that have seen affected their sales 20% or more. And that means we're subsidizing 40% of the minimum wage in Colombia, a program that has no precedent in our history. And today we are protecting more than 3 million workers with that program. And that's a very important milestone. But we also launched a program of loans with 90% guaranteed by the government of Colombia. So that means that in order to finance the payroll, in order to have investments in human capital, and also to have investments in terms of assets that could improve the performance and the adaptation to COVID-19, we're giving 90% guarantees to those loans, and we have extended those lines until June 2021. Those have been very important responses, and we have also had some tax flexibility for the sectors that have been badly affected by the virus. And we're talking about restaurants, we're talking about entertainment, and obviously we're also talking about tourism. But we must also say that the measures that we have made to protect health, to protect employment, to protect the poorest of the poor, have also been complemented with the idea of recovering Colombia. And that's why we launched the equivalent of our New Deal. We're going to have more than $50 billion in investment in the next years, and those are public, private, and also PPP investments that are going to accelerate infrastructure, clean energy, tourism, industry, housing, and that's how we are also going to connect investments in water and storage, the expansion of education, training 100,000 programmers, and being able to reach those municipalities that are from the deep Colombia, where we have seen historical records of violence and poverty. So we're going to have investments that are going to be above $2 billion just for 117 municipalities that have been the most affected by violence in the last decades and also by poverty. And that will accelerate and improve substantially the quality of life. All this is taking place at the same moment where we have the clear conviction to protect the healthcare system. We have been a country that has been interested for a long time in expanding the immunization technologies and capacities. We have become an active member of COVAX, and we decided to buy the equivalent of a coverage of 20% of our population so that we can disperse those vaccines at the moment where it's necessary and when they are available. But we will also continue to have bilateral negotiations with the pharmaceutical sector so that we can have a complement and a risk distribution. As I said, we have expanded the ICU capacity and the hospital response capacity. We have been able also to put together information that is available to take decisions at real time to attend the needs of different cities. We have been able to expand the virtual healthcare coverage and medical records online. And we will undertake new reforms for the sector in order to make it more strong, in order to finance better the attention of the more people in need, and something that we feel very proud that we will also continue to protect the Colombian people from other pathologies. That's why we have been activating and we have not left anyone behind on the regular vaccination programs in the country. And that's also the reason why we have decided to put more resources to support the expansion of all the healthcare system in the country. This is how Colombia has responded to COVID 19. We know COVID 19 represents a major threat, but as Richard has said in an article that was published some weeks ago, he said the COVID 19 pandemic is going to contribute to the largest acceleration of history that we have seen in our time. That acceleration is for us to be more aware of our responsibility to protecting the healthcare system, to fighting climate change, to have a better use and humane use of technology, and also to be able to rebuild the concept of SMEs as the most important piece for job generation. So it is a great honor for me to participate in this event, Dr. Rosenberg. It's a great pleasure for me to participate with so many experts and people that are so knowledgeable about healthcare. And I could say that Colombia has demonstrated its capacity, its institutional capacity, its resilience, and the willingness of national and local governments to endure in the midst of the situation. We have seen that the labor market has been recovering. We have expectations to grow above 5% in 2021. We know that we must all work very hard in the last 3 months of this year so that we can put an acceleration for the economy that can benefit us all. Well, we have to do it with the idea that until there's a vaccine or a treatment that has been certified, we have to adapt ourselves to this new reality and we have to adopt new measures and policies so that we can be more effective. We have seen new spikes of the virus in Europe and in other countries. We know that the risk is always there, but we also know that it's through citizen behavior, citizen culture, and citizen compromise that we can do things much different. The pandemic has showed the Colombian people the value of solidarity. With the work that has been performed by my wife, Maria Juliana, the First Lady, we have been able to distribute with individual contributions and private sector contributions to distribute more than 1 million meal packages throughout the country. Those meals can be represented in more than 68 million plates of food in a household. And we have also been able to complement that work with more than 1 million additional packages that have been distributed with state money. This is the kind of work that we want to see every day. How we can all respond to this virus, how can all respond to improve healthcare. And I'm pretty certain that our experience that is shared today helps and contributes for the analysis that we all have to make. And I also feel with certainty that when people evaluate what happened in 2020, obviously we will see a lot of regrets and setbacks. But more importantly, people will always recognize that this time the world has behaved in a much better way, accelerating history and changing many services, including the healthcare services for the good of humanity. Thank you very much.